So, do you have clients who'd benefit from a simple and effective technique to reduce pain and anxiety? There's a technique that has quite a bit of research around reducing pain, anxiety, and improving sleep quality. The research covers other areas as well, but these are kind of the main areas that there seems to be the most evidence base for so far. So, for example, there was some research around pain and sleep quality among rheumatoid arthritis patients. They underwent 10 repetitions of this technique, 1 day per week for 3 weeks. This led to a decrease in anxiety and other emotional issues, and it was very effective in reducing pain intensity. There was another study done that led to a significant reduction in pain where people used this technique once every 2 days for 15 sessions over a 1 month period, and each session was about 10 minutes again. The research seems to point that this technique helps to induce alpha waves, increase delta waves, and affect circadian rhythms during sleep, which maintains a state of deep sleep and reduces the likelihood of sudden awakening during the night. So, when used just before bed, it can be a very helpful technique for someone to have learned. There was a study done looking at reducing anxiety levels in adolescents, where they undertook a single group session of this technique, and it significantly reduced their anxiety. And there are various other studies as well, often around reducing anxiety, and normally with the technique being done either as a single group exercise where people get taught this technique as part of that group exercise, and then they just go away, they practice it, use it, and then there's a follow up at some point in the future, perhaps a month or 3 months later. Other times, the studies seem to have people practice the technique, say, every other day or practice it once a week. But it's a technique, a self hypnosis technique, that you can teach to somebody within the session and really take your time over teaching them the technique. And then once they've learned that technique in the session, they can go away, they can practice it, ideally multiple times initially. So this would just be my take in terms of teaching someone self hypnosis. Have them practice it multiple times initially, ideally multiple times per day, so that they really get used to using it, and then they can start using it, focusing on what it is that their problem is that they want to address, whether that's using it to reduce anxiety, to tackle pain, to improve sleep, reduce stress, whatever it happens to be. So, what this technique is 5 finger hypnosis. Normally, a 5 finger hypnosis session would be about 10 minutes. So, that's kind of how long it takes. It can be a bit less, a bit more. It kind of depends on the client and how they're responding, because you want to make sure that what you're doing with them is at the pace that works for them. And exactly how you do it will also vary a little bit depending on that individual client and how they're responding to what it is you're doing. So, for example, if they're struggling to think of something, maybe the way you present the technique is to be a bit more vague, or to offer them slightly more choices, or to just give them a bit more time. Or maybe you do a stage before the technique where you say, okay, during this technique, I'm going to ask you to think of this, this, and this. So, do you have some ideas of what those things can be? And then establish that beforehand. So, it's a little bit like if someone's doing a memory palace technique for memorization. If you just said, okay, now create a memory palace and then place things around that memory palace, you might think, well, I have no idea where my memory palace is or whatever it is. So what you do is you establish that beforehand. You say, oh, I'm going to ask you to create a memory palace. It will need to have these different elements. So can you work through creating that now so that when I ask you this, you know what you're doing already? So you might add that extra stage in if someone really is struggling. There's been two different ways that I've seen this spoken about in research and done. And one of them includes opening the eyes and closing the eyes. So it integrates fractionation into it. which is a kind of hypnotic technique of having someone coming out and going into hypnosis repeatedly, and that then deepens the hypnosis. The other one is someone's just got their eyes closed from the start, and then you talk through the different stages, and then once they've reached the end, this is during when they're practicing, they'll then open their eyes and come back to the room at the end. Another change is that some ask for you to focus on a time when you felt really loved, or a time that was your happiest moment. And sometimes, like if I'm doing this for myself, I would struggle to identify that. It would be easier for me to just try and have a feeling of love or happiness. So you might have to make adjustments for a client based on the kind of way they respond to your suggestions. So what I thought would be interesting is to guide you through this technique. So I'll just tell you briefly the process of the technique, and then I'll guide you through it. And if you want to engage with this, feel free to do so, but make sure that you can pay this your full attention, that you don't have like an oven on or something elsewhere that you should be paying attention to, that you genuinely can just pay this your full attention to engage with it. So when you guide the person through this process, you ask them to get comfortable. You ask them to take, say, 3 deep, relaxing breaths, and you guide them through that and make sure their out breath is longer than their in breath, etc. And you ask them to place their hands on their thighs, palms up, and then you ask them to have a sense of feeling healthy and calm, and to close their eyes and bring their thumb and forefingers together on both hands. So your hands are resting on your lap. Bring your thumb and forefingers together, and then absorb yourself in that, and then exit that. One version is exit that and open your eyes, and then close your eyes and move on to stage 2. What I'm going to guide you through here, I'm not going to do the opening your eyes and closing your eyes between each stage. I'll just take you through the whole thing in a minute. But just for note, it's down to personal preference and what you find deepens your experience. So if you find it deepens your experience most to do fractionation as well, to open your eyes and close your eyes between each stage, then just feel free to do that. Even if I don't suggest it, feel free to do that for yourself. Just at the point of moving on to the next one, open your eyes and close your eyes. So then you bring together your thumb and middle finger, and you recall an experience of love or happiness and have a sense of that feeling, that emotion. So if the person can't recall a memory, then perhaps just have them have a sense of that emotion within them. And obviously then absorb themselves in that experience. And then you have them release that touch and touch the thumb to the ring fingers. And then while they're doing that, they want to have a positive experience of being complimented. Or, so for example, when I have tried this with myself, I can't think of a positive experience of being complimented. So the thing for me would be just to imagine a kind of experience of someone complimenting me and being friendly towards me or whatever. And then releasing those fingers and touching the thumb to the little fingers, and then imagining the most beautiful place that you've ever visited. Now, again, it could be that somebody might think, well, I've never really visited anywhere that I would think of as beautiful, but they might have somewhere that they think of as beautiful. So it could be that that's what they imagine. So I would phrase it as imagine the most beautiful place that you've ever visited, or the most beautiful place you can think of in your mind's eye. And then have them absorb themselves in that, and then just take a few deep breaths, allow themselves to become even more absorbed deeper into the experience. And then they can hold that for a little while and be in that kind of relaxed state. And then in this example, I'll then count you out and just say something like 1, 2, 3, open your eyes. But in a real situation, you can say, and you can hold on to that until you're ready to come back to the room and you know that any inner benefit and inner work from this has been completed, and then just let them come back in their own time, in their own way, over a period of time. If they don't come back over a period of time and you think, well, actually the end of the session is approaching, they could do with being back here in the room so we can end our session, then say, that's it, you can come back to the room in your own time over the next minute or so. So what you're doing is allowing them the opportunity to do time distortion. They can take as long as they like in their mind to come back to the room, but in reality, it's only going to be 1 minute of clock time. So that's the experience I'm going to guide you through now. So if you want to follow along to this, remember, make sure that it's safe to do so, that you don't have to have your attention on anything else at all. Don't even kind of think, oh, well, I'm sure it'll be fine. The oven's on, but I don't need to worry about it for an hour, or whatever it happens to be, so I can engage in this because this will only be 5-10 minutes long. Just in case you fall asleep or anything from this, make sure that when you do this, it's because you can genuinely pay this all of your attention with nothing else to do. So, allow yourself to get comfortable and just take 3 deep, purposeful breaths and make each out breath longer than the in breath. Breathing in and breathing out. That's it. Breathing in and breathing out. And then a third breath, breathing in and breathing out. That's it, all the way. And then just bring your thumb and index fingers together. And as you do, allow your eyes to close and allow yourself to begin to remember a feeling of being healthy and calm. And just absorb yourself in that experience of feeling healthy and calm. That's it. And maybe it's a feeling of being healthy and calm from some memory from the past. Or perhaps it's just a feeling that you know within you. So just absorb yourself in that feeling. That's it. All the way deeper and deeper into the feeling of being healthy and calm. Maybe noticing what that feels like around your face, your shoulders, your head, your neck, through your body. That's it. And then release the thumb and forefingers, going deeper and deeper into the experience. That's it. As you now bring together the thumb and middle fingers. That's it. And as you bring together the thumb and middle fingers, begin to have an experience of feeling love and happiness, perhaps with some memories of deep, meaningful love and happiness. Really absorbing yourself in the feeling and the experience of feeling love and happiness within you. Noticing what that feels like through your body, through your face, perhaps through some warmth or some changes in how you physically feel and experience the sensation of love and happiness. Deeply absorbing yourself in that experience now. Perhaps noticing yourself drifting deeper into the experience with each out-breath. That's it. Absorbing yourself all the way into the experience. And then allowing those fingers to part as you go deeper and deeper into the experience, and then bringing together the thumbs and the ring fingers as you begin to also draw up an experience of being complimented and what it feels like to be honestly complimented by somebody whose opinion you care about. What the experience is of being complimented, whether it's a memory or just what you know the experience to be of someone complimenting you and praising you and pointing out those positives about you, what they like about you perhaps, what they feel you're good at, honestly and authentically complimenting you, just absorbing yourself in the experience of the compliment, deeper and deeper, that's it. And then allowing those fingers to drift apart as you go deeper into the experience, and bringing the thumb and little fingers together as you absorb yourself in the experience of the most beautiful place that you can imagine, whether it's somewhere you've visited or whether it's somewhere you've perhaps always wanted to visit or somewhere made up. Just the most beautiful place in your mind. Notice what you can see there, what you can hear there, what it smells like there. Perhaps reaching out and touching things, maybe touching the ground beneath your feet, what each footstep feels like. Perhaps noticing what the sky looks like. The smells, the sights, the sounds. Really absorbing yourself in that most beautiful place in your mind. Maybe walking over to things with different textures, touching those with your fingertips, feeling those textures under your fingertips. Like noticing that there's a difference in the texture from running the fingertips around the bark of a tree compared to touching a petal of a rose delicately between your thumb and fingers, or running your finger gently through some soft grass, or resting your hand down into the sand of a beach, and the difference between resting a hand down onto damp sand on a beach versus warm, dry sand. Just exploring the sensory experience of that beautiful place in your mind as you drift deeper and deeper into the experience, taking a few deep breaths, allowing those out breaths to be longer than the in breaths as you go deeper and deeper, more absorbed in the experience. And I'll give you a few moments of peace and calm to do any inner work before counting you back to the here and now. That's it. All the way. 1, 2, 3. Opening your eyes and coming back to the here and now. So that is 5-finger hypnosis. A technique that's very easy to learn, very easy to practice, to have a client practice within a session where they just have to bring their thumb and fingers together. So they can just practice that in a session perhaps a number of times. So I just ran through it once, but you could always have them, open their eyes, maybe count them to have their eyes open, like 1, 2, 3, open your eyes, and then say, would you like to go through that experience again to practice it a second time? And then maybe you go through it a second time, guiding them through that. And then again, you could get to the end and count 1, 2, 3, open your eyes. Would you like to go through that again to practice it a third time before you can then practice it in your everyday life as a task that you would set to that client for them to do when they're at home? And you might set them to do it once a week or daily initially. So say you were seeing a client weekly, you might say, between now and next time, I'd like you to practice this technique once a day. And say it was to do with anxiety, you might say, I'd like you to practice this technique once a day, 10 minutes after, 20 minutes after you wake up in the morning and you've got yourself dressed and ready for the day. Set an alarm clock for, say, 20 minutes or half an hour or something. Obviously, they need to make sure they have this length of time free in the morning before they have to do anything. But you could say to them, set an alarm clock for 20 minutes, half an hour later, and then sit down in a chair and just guide yourself through this process and just do that once a day, every day, and try and do it at least 5 times this week between now and when I see you next week. So you might set a task like that, and then between sessions, you might, between the next bunch of sessions, have them do it, just practicing it a couple of times a week so that they can then use it when they need it because they've mastered it by then. So it's a very handy technique for someone to be taught, for a therapist to teach, to people to learn, for them to then go and do it for themselves. And the research is that it definitely is incredibly helpful for anxiety predominantly, and pain and sleep. So they're the 3 main things that there seems to be the main research currently that I've seen for its use. So there's been anxiety in relation to the recent pandemic and community anxiety to do with that. There's been, so that's just generic, anyone who's feeling anxious taking part in the research. Then there's been anxiety among young people for the same reason, and research on that. There's been research on anxiety around exams and the pressure of things like that within college or university. There's been research around the use of it for anxiety and pain and sleep for things like illnesses, arthritis. There's been the focus on teaching it to families, for anxious families who are dealing with a loved one who's going through significant medical challenges. So there's a number of different areas of research that have happened, and so hopefully this is something that perhaps you could find helpful, or you may think could be helpful to your clients. If you found this video helpful, by the way, feel free to give it a like, and feel free to leave comments below about how you found this technique, me just guiding you through it here, but also as something that you may or may not choose to use. And if you wouldn't choose to use this as, or integrate this into anything, into any of your work, perhaps sharing the reasons for that. Maybe the technique is too long, maybe it's one you just don't think would resonate with your kind of clients, or maybe you don't know if it would be helpful to your kind of clients. And obviously, if you want to see more videos like this, I try and post about helping therapists to be the most effective therapists they can. Thank you for watching. So if you would like to learn more about how to do hypnotherapy, then you can always check out my hypnotherapy books. They're available in paperback and as ebooks. The link is in the description. And there is Hypnotherapy Revealed, Introduction to Hypnotherapy. Hypnotherapy Revealed, The Ericksonian Approach. And a big book of hypnotherapy transcripts. which includes more than just the hypnotherapy scripts. So together, these books make up quite a complete introduction to how to do hypnotherapy, especially from the Ericksonian approach.